I am Dr. Shivaraj. I am a consultant pulmonologist working in Columbia Hospital, Whitefield. Pulmonary embolism, normally there are some direct tests and some indirect tests. Normally any persons with the pulmonary embolism, they will come with the complaints of the shortness of the breath, which is suddenly worst in the couple of days, and also they may be having little bit chest pain, and particular where there is a blockage will be there, and sometimes they will be having the blood in the phlegm. So these are the commonest three symptoms usually people will be presenting. When you do the indirect test is like sometimes ECG, some findings can tells like there is some sort of the clot in the lungs, and also important thing is the echo can definitely tell like there is usually, as I told, so there is a heart and lungs are interrelated. If anything is there in the lungs, there is a clot, for example, it will reflect negatively on the right heart. If the right heart or the right ventricle is not performing well, there is too much of stress pattern in the right ventricle, that indirectly tells like there is a clot in the lungs. This is an indirect test. The commonest, the direct test, the gold standard test is a CT pulmonary angiogram. This is the CT pulmonary angiogram can able to detect like whether it is the clot is there or not. Sometimes if the patient is having the kidney disease where you cannot able to do this one, there is called the ventilation perfusion scan. This ventilation perfusion scan can definitely able to diagnose the pulmonary embolism. The tips for the pulmonary embolism prevention is normally usually the smoking. So better the people, if you stop the smoking, that is again one of the things that smoking itself can one of the culprit can cause. And second, usually any patients if you are having the post-op, so they have to mobilize as early as possible. And also usually in the accident and all these things, instead of just neglecting the things, you have to correct this with the surgery as early as possible. And always be active. If the person is bedridden for some other diseases or some other issues, what will happen? They are called the legs. Their legs is called the peripheral arch. When the person is started moving, there is a contraction of the legs. When there is a contraction of the muscles in the leg, that will push us the blood to the heart. If they are not walking, they are from morning to evening just sitting one place, the contraction of the muscles is not happening. So there is a stasis of the blood, there is a stagnation of the blood. When there is a stagnation of the blood, the clot formation will be happening. That's the reason always we suggest as much as possible be physically should be active. Try to avoid to become a sedentary.